I'm Rick Burkholder. I'm the head athletic trainer for the Kansas City Chiefs. I would say that my role here is to run a healthcare facility within a football team. Our main objective is to take care of the players as it pertains to health. So we certainly take care of injuries because it's a big part of our game. We like to take the approach that we're more on the preventative side than on the treatment and rehabilitation side. Certainly with the trauma of the game, you're going to get injuries, but we would like to keep those numbers down. So we work extremely hard at trying to prevent injuries and do some things to help the players recover and perform at an optimal level before they would get traumatic injury. The big component on my end was the recovery room. So we gave our players a place where they could come get their bodies flushed out, get their legs back for the next day. That room includes massage therapy and some other tools, but the main component is the NormaTec recovery system using pneumatic boots. And I would say that over 75% of our team utilizes that room. That room is really for the players who aren't injured, and they're just using it as part of their prep and recovery. So they may go into that room before practice and do some foam roller or get in the pneumatic boots or use the massagers in there just to loosen their muscles. Then after practice, they're in there in the pneumatic boots, elevated and getting some of the metabolic waste out of their legs so that they can perform the next day. Our feeling as a staff, athletic training staff, coaching staff, management, is the more reps you get at practice, the better you'll be in a game. So we think this is a particular sport that you really have to practice. And our days lost for practices was way down. It's more than an athletic training room and recovery room, because it's an area where we actually have physicians come in and do procedures and not surgical procedures, but other procedures. And the NFL comes in and does drug testing in our room and blood draws in our room. This facility has MRI and X-ray in it. So it's a healthcare facility, and I basically run that healthcare facility and then have a staff that really does all the day-to-day work.